Bonjour à tous. Good morning, everyone. Now, please don't be too worried. I'm back in isolation at home, but that doesn't mean you have to be. I've got some important news to share, which I'll do from quarantine here at Rideau Cottage. But before I get started, I want to address the hateful acts that far too many communities in our country have continued to face this week. It's unacceptable to see a swastika painted in Downsview Park in Toronto. It's unacceptable to have hateful graffiti painted on a mosque in Edmonton. Anti-Semitism and Islamophobia have no place in our communities, and hatred and discrimination of any kind have no place in our country. This is something we'll never stand for, because the cost of turning a blind eye, it's much too high. Together, we must always denounce these unacceptable acts and support communities. That's exactly what our government will continue to do. It's been a difficult few weeks for many people across the country. People in London continue to grieve the loss of the Afzaal family. In Indigenous communities, this has been a time of mourning. As a country, we have to continue to work for justice and building a better Canada for everyone. La semaine dernière et en début de cette semaine, j'ai eu des rencontres très productives avec le G7, l'OTAN et l'Union européenne. Lors de ces différents sommets en Europe avec nos alliés, on a réalisé des progrès importants, que ce soit pour en finir avec la pandémie ou pour créer des emplois pour la classe moyenne. Évidemment, toute personne qui revient de l'étranger doit faire une quarantaine pendant 14 jours, moi y compris. Donc, au cours de la prochaine semaine et demie, je vais travailler en isolement ici à Rideau Cottage. This morning, I want to share some important updates about vaccine deliveries, supporting communities, and our plan to safely reopen. Let's start with news on vaccines. Canada is getting millions more Moderna doses brought forward from our summer shipment schedule into June, and we're locking in shipments for the first half of July. We've worked hard with Moderna to make this happen, and we're also getting extra doses from the US. Minister Anand will have the breakdown of the numbers later this morning, but here's the bottom line. Just like we surpassed our delivery numbers for the first quarter of this year, we're doing the same for the spring quarter. That'll mean for the end of June, as promised, we'll be at well over 50 million doses total. And by the end of July, we'll be over 68 million doses for Canadians. Des livraisons de millions de doses du vaccin de Moderna prévues pour plus tard dans l'été seront devancées en juin et en juillet. Pour juillet, on s'assure de recevoir ces livraisons dans la première moitié du mois. Et on a travaillé sans relâche avec Moderna pour arriver à cette entente. On a aussi reçu des doses supplémentaires de la part des États-Unis. La ministre Anand va partager les détails un peu plus tard ce matin, mais voici ce qu'il faut retenir. Tout comme on a reçu plus de doses que prévu pour le premier trimestre, on va aussi en recevoir plus pour le deuxième trimestre. D'ici la fin juin, tel que promis, on va avoir reçu un total de plus de 50 millions de doses. Et d'ici la fin juillet, on va avoir reçu plus de 68 millions de doses pour les Canadiens. I want to thank Minister Anand, her department, and our teams in Washington, D.C. and around the world who are working to get Canadians as many doses as quickly as possible. A big shout out as well to Minister Haidu and everyone at the Public Health Agency and the National Operations Centre for coordinating the rollout across the country. We'll have more details to share next week about shipment dates for the new Moderna doses, and of course, we'll provide that information to the provinces and territories right away so that they can plan to get those doses into arms as quickly as possible. Because that's what this is about, getting you your vaccine as soon as possible, getting it to your parents, friends, and neighbors, because every dose keeps someone safe. Every dose is a step closer to the end of this pandemic for Canadians. Grâce à l'arrivée d'un aussi grand nombre de vaccins et au fait que les Canadiens sont nombreux et enthousiastes à se faire vacciner, on est en train de mettre fin à cette crise au Canada. Presque 75% des Canadiens éligibles ont maintenant reçu une première dose. Alors ensemble, on va vaincre la COVID-19. Mais c'est important de continuer à recevoir nos premières et nos deuxièmes doses aussitôt que possible. C'est ce qui va nous permettre de revoir les gens qui nous ont manqué pendant le confinement et commencer à faire de plus en plus d'activités qu'on aime. Together, we will get through this crisis. No one and no community will be left behind. On that note, I want to give an update on support for Saskatchewan First Nation in Ontario. In the last few weeks, COVID-19 cases have risen very quickly in the community, mostly among children. At the end of May, we approved a deployment of the Canadian Rangers to help get the situation under control. Alongside the community, they've worked very hard to keep people safe. But even so, cases remain far too high. That's why we're approving additional support from the Canadian Armed Forces for Saskatchewan First Nation. The Armed Forces will be in the community until at least the end of the month to help with everything from isolation sites to delivering food. On va continuer d'être là pour toutes les communautés pendant cette crise et pendant la relance. Hier soir, j'en ai justement discuté avec les premiers ministres des provinces et territoires. Comme je l'ai dit au premier ministre, mon objectif est d'aider les Canadiens durant cette crise, de poursuivre la distribution des vaccins et de collaborer pour qu'on ait une réouverture responsable. À ce sujet, celui de la réouverture, notre gouvernement en aura plus à dire la semaine prochaine concernant notre plan qui va permettre aux gens de recommencer à voyager tout en assurant la sécurité de tous les autres. Finally, this morning, I want to address some recent developments in the House of Commons. The work we do in Parliament matters. And it matters because it affects you, your family, and your communities. In the House right now, we're working to extend support that millions of Canadians need to get through the final stretch of this pandemic, from the wage subsidy to small business loans to the sickness benefit. Let's be clear. These benefits will end in a few weeks if the Conservative Party and the opposition parties continue to obstruct our efforts to pass legislation. Frankly, I don't think anyone is surprised to see the Conservative Party standing in the way, but it's disappointing to see the NDP and the Bloc both join in these political games. This is progressive legislation and a progressive agenda that will help Canadians. There's important work to be done. And not only on supporting people through this crisis, we're also working to ban the unacceptable, discredited, and harmful practice of conversion therapy despite opposition by Conservative politicians. And we're working to reach net zero emissions by 2050. In other words, we're working on what matters to you. Unfortunately, not all parties in the House of Commons have the same priorities. Not all parties are focused on having your back. Instead of finding real solutions to real challenges Canadians face, the Conservative Party is playing political games. Just yesterday, they put forward a crass political attack on a man who has spent a lifetime serving his country as a police officer, as a decorated soldier who served 3 tours in Afghanistan, and now serves as Minister of National Defense. I've been fortunate to know Harj for a long time. He's one of the most honest and hardworking people I've ever met. His entire career, and now as minister, he's been dedicated to transforming the culture of our military. He's working to combat sexual misconduct in the armed forces, including on expanding the Sexual Misconduct Response Center. And he will keep doing that work. We know there's still much more to be done to protect all of those who choose to serve their country, so it's unacceptable that Conservative politicians would choose to slander Minister Sajjan's reputation instead of working with us to keep Canadians in uniform safe. I said it's unacceptable. I didn't say it was surprising. Pendant qu'Aaron O'Toole fait de la petite politique malhonnête, nous, dans notre équipe, on reste concentrés sur les vrais enjeux. On soutient tous les membres des forces armées. On soutient vous et votre famille et on travaille à tous les jours pour bâtir un avenir meilleur pour tout le monde. Merci. Je suis maintenant content de prendre vos questions.
Thank you, Prime Minister. We'll now start with questions. Operator, over to you.
Thank you, merci. Please press *1 at this time to ask a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question est de Christian Noël de Radio-Canada. La parole est à vous.
Bonjour, M. Trudeau. Vous avez dit il n'y a pas si longtemps, on n'aura pas d'élection en temps de pandémie, sauf si le Parlement est dysfonctionnel. Avec ce qui se passe cette semaine en fin de session, trouvez-vous que le Parlement est dysfonctionnel?
C'est désolant de voir le niveau de toxicité et de jeu politique que les partis d'opposition, particulièrement les conservateurs, sont en train de jouer. Mais nous travaillons encore extrêmement fort pour passer les éléments de notre budget qui vont aider les citoyens pour avancer sur la législation et passer la législation sur la carboneutralité, pour bannir la thérapie de conversion, qui est une pratique affreuse et dégueulasse. Nous allons continuer de travailler sur les choses qui importent pour les Canadiens. Et je sais que les Canadiens sont en train de regarder attentivement les partis d'opposition pour s'assurer qu'on puisse livrer ensemble les choses qui sont importantes.
Ministre Vie, question?
Oui, je remarque que vous n'avez pas répondu à ma question, à savoir si vous trouvez que le Parlement est dysfonctionnel ou pas. Je vous donne la chance, dans ma question de suivi, d'y répondre. Malheureusement, je dois aussi vous poser une question sur un autre sujet. Donc, si vous étiez capable de mettre tout ça ensemble, j'apprécierais beaucoup. Quand on parle de certification vaccinale maintenant pour les Canadiens, les résidents permanents, bientôt les voyageurs, quels sont les principaux obstacles, notamment avec les provinces, qui restent à régler avant de mettre tout ça en œuvre?
Merci, Christian. D'abord, on verra bien si on arrive à faire passer ces éléments de législation pour aider les gens. On a fait une promesse dès le début qu'on allait être là pour appuyer les Canadiens. C'est désolant que les autres partis semblent pas prendre cette responsabilité au sérieux, mais j'ai encore espoir qu'on va pouvoir passer les éléments du budget qui vont aider les gens, on va pouvoir passer la législation sur la carboneutralité et j'appelle à tous les autres partis de faire leur part pour que le Parlement continue à fonctionner. Par rapport au certificat de vaccination, nous sommes en train de travailler sur une solution plus moyen terme, c'est-à-dire quelque chose qui serait facilement reconnu à un niveau standard par les autres pays pour que les Canadiens voyagent. Et à ce niveau-là, on est en train de travailler de façon très positive avec les autres premiers ministres qui veulent bien travailler avec nous pour s'assurer qu'eux, ils contrôlent encore les données des Canadiens, mais qui passent l'approbation au gouvernement fédéral pour pouvoir faire une certification nationale ou pan-canadienne pour les voyageurs, pour les gens qui iraient à l'international. Mais dans l'intérimaire, nous travaillons avec l'application ArriveCan, qui est déjà bien établie, qui est en utilisation pour les Canadiens et les voyageurs qui arrivent au Canada sous les conditions actuelles, pour qu'ils puissent partager une image de leur copie de vaccination pour certifier quand ils vont arriver à la frontière qu'ils ont effectivement été vaccinés. C'est pas une solution idéale, mais c'est la solution qu'on va pouvoir mettre en place rapidement pour que les gens puissent avoir quelques options de plus cet été s'ils sont pleinement vaccinés, pour avoir une solution plus long terme et robuste dans les mois à venir.
Thank you, sir. And I've had a reporter ask you to repeat that in English, please.
We are working on two tracks in terms of proof of vaccination for Canadians who wish to travel. First of all, in the initial phase, we're going to be working with the ArriveCan app in ways that people can upload an image of their paper proof of vaccination or online proof of vaccination so that the border agents on their return to Canada can verify indeed that they are fully vaccinated. That's something that we will have in place in the coming weeks so that people can have a few more options if they're fully vaccinated this summer. But for the fall, in the medium term, we are working with the provinces to establish a national certification of vaccination status that will be easily accepted around the world for people who need to travel internationally. And that will involve working together with the provinces, because the provinces, of course, have your health data and your vaccination status. And we want to make sure we're both protecting privacy and protecting jurisdictions, but getting a clear federal notification that other countries can see that we have that you've been fully vaccinated. So that's what we're working on for the medium term, but there is a solution for the coming weeks through the Arrive Can app.
Thank you. Next question, please, operator.
Thank you. The next question is from Ryan Timilty of the National Post. Please go ahead.
Yeah, sir, I'm wondering if you can explain a little bit more why you chose to extend the border provisions for a full extra month, and why fully vaccinated travelers wouldn't be able to cross the land border more simply.
As we said, we are looking forward to getting back to normal as quickly as possible. But we're not out of this pandemic yet. We're still seeing cases across the country, and we want to get them down. At the same time, we also know we have to hit our targets of 75% vaccinated with the first dose, at least 20% vaccinated at the second dose, before we can start loosening things up. Because even a fully vaccinated individual can pass on COVID-19 to someone who is not vaccinated. And that means we have to really make sure that not only people who are fully vaccinated can travel, but that the communities to which they will return are not at risk, because even though they are protected from hospitalization, the people around them might not be. That's why we are sticking with our principle of doing everything necessary to keep Canadians first, keep Canadians safe first and foremost, even as we move forward on loosening restrictions in a responsible way. That's what I talked with the premiers about last night, and I can tell you there is a tremendous focus on making sure we're working together to do this as quickly and safely as possible, because we all want to get back to normal, which means, yes, moving quickly, but it also means avoiding any further massive waves.
Et en français, s'il vous plaît.
On a justement eu une conversation là-dessus avec les premiers ministres hier soir. C'est important de souligner que nous avons fixé un objectif au fédéral de 75% de première dose qu'on est en train d'atteindre, mais aussi de 20% avec une deuxième dose. On n'est pas là encore, mais on s'attend à y être dans les semaines à venir, ce qui est une très bonne nouvelle, et on encourage tout le monde à se faire vacciner avec cette deuxième dose le plus rapidement possible. Parce qu'il faut se souvenir que même si un individu est protégé des pires conséquences de la COVID s'il est double vacciné, ça ne l'empêche pas de passer la COVID aux gens de son entourage, à sa famille, à sa communauté, même s'il a une double vaccination. Alors, c'est pas juste une question de dire « Ah, OK, t'es protégé, t'as une double dose ». C'est une question aussi de protéger la communauté qui n'a pas encore suffisamment de deuxième dose. Alors, on va continuer d'évoluer, on va continuer d'assouplir les règles de façon responsable pour que les individus qui sont pleinement vaccinés puissent travailler, mais puissent voyager, mais soient pas en train de mettre à risque les autres Canadiens. C'est toujours un équilibre. Je comprends l'impatience des gens, mais je comprends aussi qu'il y a personne qui veut voir une résurgence de la COVID-19.
A follow-up question, Ryan?
Yeah, sir, you mentioned the figure of 68 million vaccines by the end of July. By my quick math, that's enough to vaccinate all Canadians under the age of 12, over the age of 12. You frequently set September as the target when you expect all Canadians to be fully vaccinated. Given these new doses, given this number, do you expect that to happen sooner than September?
We certainly are very hopeful that everyone who wants to is going to be fully vaccinated before September. As you say, we have numbers of vaccines coming in by the millions in the coming weeks and into July. And that's great news, because the sooner the largest possible number of people get double vaccinated, the sooner we're going to be able to get back to more and more normality. And that's what we all want. So we're continuing to do our part in working hard to get doses in as quickly as possible, to bring doses that we've ordered for later in the summer and into the fall forward as we need to max out the vaccination process to get it as quick as possible. The provinces are continuing to step up their delivery of doses into arms across the country and are doing a great job. And all Canadians are doing their part by showing enthusiasm and positively and understanding that the more of us get 2 doses, the more we are protected individually, but the more also our community is protected, and therefore we can get into a better summer and a much better fall.
Merci. Prochaine question. Operator.
Thank you, merci. La question suivante est de Lina Dib de la presse canadienne. La parole est à vous.
Oui, bonjour, M. Trudeau. Moi, j'aimerais savoir où en sont les discussions avec les Américains à propos des vaccinés à l'AstraZeneca, qu'ils soient vaccinés 1 fois ou 2 fois. Avec ce vaccin-là, étant donné que les Américains ne semblent pas vouloir reconnaître ce vaccin-là, ça va signifier quoi pour les Canadiens qui veulent voyager et traverser la frontière?
Et c'est une question qui a effectivement été soulevée dans les discussions avec les Américains. Nous, on a reconnu 4 différents vaccins comme étant sécuritaires et efficaces au Canada, mais on sait que d'autres pays, dont les Américains, ont parfois approuvé d'autres vaccinations que nous, on n'a pas, ou des vaccins que nous, on a approuvés, que eux n'ont pas. Il va y avoir un travail de coordination et de collaboration à travers le monde pour pouvoir s'assurer que les gens qui sont vaccinés, qui sont protégés et qui protègent la communauté contre la COVID-19 peuvent voyager. C'est des discussions qui continuent, mais certainement, on va s'assurer que les gens qui ont eu 2 doses d'AstraZeneca ou 1 dose ne seront pas désavantagés quand vient le temps de voyager et d'être protégé par de la COVID. Mais c'est des discussions qui vont aboutir dans les semaines à venir, on l'espère, à temps pour que les gens puissent commencer à voyager, parce qu'on n'est pas tout à fait rendu là encore.
And in English,
D'accord,
please.
donc
Yes, this is an issue that has come up. That different countries have different lists of approved vaccines. Canada has approved 4 vaccines as safe and effective, and we'll be recognizing those for travelers coming to Canada when the time comes, but certainly recognizing those as protecting Canadians. Other countries who haven't recognized the full suite of vaccines is an issue that we're going to have to deal with, hopefully in the coming weeks. We are engaged in discussions with Americans on that and with partners around the world to ensure that people who are protected from COVID-19 are able to travel. But we hope to be able to resolve those issues in the coming weeks in time for bringing in of loosened restrictions around travel.
Lina?
Donc, si je comprends bien, M. Trudeau, vous n'avez pas encore de garantie que vous allez pouvoir traverser cette frontière pour aller aux États-Unis. Et pouvez-vous aussi m'expliquer pourquoi on avait besoin d'aller chercher 1 million de doses de Moderna chez les Américains? Il me semble qu'on en a en masse et qu'il y a plein de pays qui n'en ont pas.
Tout d'abord, il y a énormément de questions qui se posent encore par rapport au déplacement à l'international et les différents pays sont en train de regarder ces conditions. Les États-Unis n'ont pas encore dit exactement quels seraient leurs critères et comment ça va évoluer dans les semaines à venir. On est en train de travailler avec eux pour qu'on puisse s'aligner, mais cette question d'assurer que des gens qui soient pleinement vaccinés ici au Canada aient tous les avantages, quels que soient les vaccins approuvés qu'ils aient reconnus, c'est une priorité pour moi. Et par rapport à l'autre question, ma responsabilité, c'est d'assurer que les Canadiens se fassent vacciner le plus rapidement possible. Comme vous avez vu, on a parlé des 100 millions de doses que le Canada est en train de s'engager à partager avec le monde. On va continuer de faire notre part à travers le monde en même temps qu'on s'assure que les Canadiens soient vaccinés le plus rapidement possible.
Merci. Prochaine question. Operator.
Merci, thank you. The next question is from Tonda McCharles of the Toronto Star. Please go ahead, your line is open.
Yes, hi, Prime Minister. Thanks for taking our questions. As early as April last year, you stood outside Rideau Cottage and told the country that vaccines were going to be the way out of this, and yet here we are, more than a year later, 6 months after vaccines have entered Canada. And so I'm very curious as to how do you explain to Canadians how it's possible that the government still does not have the ability to roll out a system of vaccine certification, and why you haven't addressed the scientific recommendation that was made 6 weeks ago to end the 3-day hotel quarantine?
Okay, first of all, Tonda, Canada is at the very top of the G20 in terms of numbers of Canadians who've been vaccinated with at least one dose. Our rollout of vaccines has been extraordinary, and I want to thank not just all the folks who've worked hard on signing the contracts, on delivering on those contracts into Canada so that we are in an enviable position from people around the world, but also all the frontline healthcare workers in the provinces across the country who've been delivering those vaccines by the millions into Canadians. And I have to also thank all the Canadians who have stepped up with enthusiasm to get themselves vaccinated, to protect themselves, but also to protect their loved ones. That is something that has been a tremendous success. And certainly is something we're going to continue to make sure we push through to the end on and get everyone vaccinated by the end of the summer, hopefully, so that we can have a much better fall. In terms, what was the second part of your question, Tana?
Well, my question is not about vaccination. My question is about how is it this much later you don't have the ability to roll out the vaccination certificates to allow people to travel? How is it that you haven't lifted the hotel quarantine? So I'm just repeating my first question. That's not my follow-up.
Yes. Fair enough. We'll give you your full set of questions, Tonda. No, thank you. First of all, the certification is something that we have to work on with the provinces. The federal government doesn't have records of vaccinations of Canadians. In our country, we have a division of responsibilities in regards to the Constitution that allows the provinces to be deliverers of healthcare and keeps them in control of the healthcare system. So that is why we are working with the provinces on establishing a formalized certification of vaccine. But you will understand that the priority in the provinces and indeed across the country was rolling out vaccinations and controlling the spread of COVID-19. And that is what we have worked on. Now, as we get closer to reopening, we have a path towards people using their proof of vaccination that they have already received to be able to travel this summer. But we will have a more formalized process in line with what countries around the world are doing in order to keep people safe. And that, in terms of establishing international norms, in terms of making sure they're actually approved and usable in all the countries that Canadians want to travel to, will take a coordinated effort by the world, even if Canada is advancing faster than the rest of the world in terms of vaccination, as you know. And in regards to the government-approved accommodations, I think people need to understand what the principle and why that was brought in. It was brought in to ensure that the arrival test that someone takes is negative before they return home to their family to their 2-week quarantine. That's why we brought in that up to 3-day government-approved accommodation as a way of ensuring that anyone who was traveling had a negative result here in Canada before they're able to go off on their own to quarantine at home. So in many cases, those results have come back quickly and people haven't had to stay all 3 days. But we brought that in as a way of ensuring and reassuring Canadians that people traveling into the country are not a significant source of spread of COVID-19, and it has worked.
Follow-up, Tonda?
Thanks. My next question, notwithstanding everything that you said about your Minister of Defense, why do you not replace him, given the lack of confidence that the House of Commons has expressed and many others outside the Commons and in and outside the military have expressed?
I think it's unfortunate to see that opposition parties in the House have descended to a level of crass personal attacks that, quite frankly, is not what Canadians are looking for and looking at right now. I have worked with Harj for many years, and I know the level to which he is dedicated to transforming for the better the culture of the military in many ways. He's certainly not a part of the old boys club that is causing such problems right now in the military. And the work that he and so many other individuals and organizations are doing to make sure that every single woman and man who serves in the armed forces is properly supported, properly protected, given the resources when unacceptable acts happen, and given the supports necessary, but also end the culture that has tolerated harassment and misogyny for far too long, along with other types of discrimination in the armed forces. He continues to have my confidence. He is the right person for the job.
Thank you. Next question, operator.
Thank you, merci. La question suivante est de Boris Proulx. Le Devoir, la parole est à vous.
Bonjour, M. le Premier ministre. Vous avez parlé tout à l'heure du Parlement potentiellement dysfonctionnel. Vous avez mentionné la loi sur le budget C-30, la loi sur le projet de loi sur les thérapies de conversion, celui sur la carboneutralité. Je vous ai pas entendu sur le projet de loi C-10. Avez-vous abandonné l'idée de le faire adopter d'ici mercredi?
Non, on espère encore pouvoir avancer le plus possible sur C-10. Malheureusement, le positionnement et les jeux politiques que le Parti conservateur est en train de jouer par rapport à ce projet de loi-là sont vraiment désolants, et on voit déjà qu'ils comptent faire les mêmes jeux au Sénat. Nous allons continuer d'avancer là-dessus parce qu'on sait à quel point les artistes sont importants et que le monde est en train de changer, et de s'assurer que les genres de règles qui s'appliquent à nos stations de télévision, à nos postes de radio depuis des décennies trouvent une façon aussi de fonctionner dans une ère numérique où on a des Netflix et des Spotify. Ça va être extrêmement important. Malheureusement, les conservateurs, encore une fois, démontrent qu'ils sont complètement indifférents au milieu des arts et de la culture et bloquent ce projet pour des raisons inventées. Et nous allons continuer de travailler avec d'autres partis pour avancer le plus possible. Mais il y a des limites sur ce qu'on peut faire dans une situation minoritaire quand les conservateurs veulent vraiment causer des problèmes pour nos artistes à travers le pays.
And in English, please.
We know how important it is to make sure that the very same principles that have ensured that Canadian artists succeed by ensuring that radio stations and TV stations and networks across the country over the past decades have always been there to support and promote Canadian content. The world is changing. We need to make sure we find out ways of promoting and supporting Canadian content, and the artists and producers and workers in our cultural industries are successful in a world of Netflix and Spotify and online streaming services. That's what C10 is all about, and that's what we're very much focused on moving forward on. Unfortunately, the Conservative Party, that has never been there to support creatives or artists or our cultural industries in this country, is choosing to block and obfuscate and spread misinformation and disinformation. And unfortunately, we're seeing that it is likely to come from the Conservative Party in the Senate, where they still play partisan games, even though the rest of the Senate is working hard to be more independent. So we are hopeful that we're going to continue to be able to advance on this, but the level of partisanship and the low level of support for our artists from the Conservative Party is indeed of concern.
Mr. Viporos?
Oui, en suivi, vous avez mentionné le Parlement dysfonctionnel tout à l'heure, la question des élections. Est-ce que, selon vous, il serait prudent ou sécuritaire de tenir des élections avant que la frontière avec les États-Unis ne soit ouverte ou avant que la population ait à 75% une deuxième dose de vaccin?
Évidemment, comme on a dit depuis le début, notre priorité, c'est d'être là pour aider les Canadiens, pour leur envoyer les appuis nécessaires, pas juste pour se protéger pendant cette pandémie, mais pour assurer une économie forte et un retour économique qui inclura tout le monde. On a mis de l'avant des propositions et des projets de loi, incluant notre budget en 2021, qu'on est en train encore de travailler pour passer à la Chambre des communes, qui va être là pour aider les gens. C'est sûr que les conditions s'améliorent étape par étape à travers le pays. On commence à s'approcher du 75% une dose, 20% deux doses. On va devoir dépasser ça au courant de l'été. Mais la sécurité des Canadiens sera toujours à l'avant-plan de nos réflexions par rapport à comment on va mieux les servir et livrer pour eux à tous les jours pendant cette relance.
Thank you. Next question, please, operator.
Thank you. Our next question is from Mia Rapson of the Canadian Press. Please go ahead.
Hi, good afternoon. So you are one of the 2 million Canadians who got a first dose of AstraZeneca, and we've had another change in guidance this week on what people should do now. It's saying preferred to get a different second dose of mRNA. A lot of people are angry again. I'm just wondering what you can say about what you plan to do. What you said a few weeks ago, your doctor had advised you to get a second dose of AstraZeneca, if that's changed for you, and what you say to Canadians who, again, are confused and a little bit alarmed that the guidance constantly changes and they're not sure what to do.
Every step of the way, the scientific guidance has evolved based on data that's coming in from Canadians, from studies around the world, so that we can make the very best choices to keep Canadians safe every step of the way. The one thing that has not changed is that all the vaccines approved in Canada are safe and effective against COVID-19. So anyone who got any of the vaccines approved in Canada did the right thing, because getting them early, as so many Canadians have, and getting them quickly has been part of the story that we're showing, where we're leading the world in terms of vaccination, and we're on our way to getting through and into a much better summer because of it. Like many Canadians, I am looking forward to my second dose, which I hope to get soon after coming out of quarantine in the next few weeks. But as to which dose, I will take whichever dose is offered to me. I will do what all Canadians should do, which is follow the best advice of the experts around them, including NACI and their family doctors. And I will be reassured, as all Canadians should be, that getting that second dose is the best way through this pandemic, not just for you, but for the people you love.
Follow-up, ma'am?
Yes. So you talked earlier about negotiations and discussions with the Americans in particular on getting vaccines that aren't authorized there to allow Canadians to travel. But what is Canada willing to do about Canadians or others who want to come into Canada who haven't been vaccinated with a vaccine that we have authorized? What are we going to do about looking at vaccines and allowing people in who aren't using one of the 4 vaccines we've authorized?
That's an excellent question, Mia, and it's certainly something that we will have to resolve before we reach that moment of reopening to foreign travelers and people coming into the country. I can assure you that our medical community and our experts are looking very carefully at that, including also looking at what the WHO approved vaccines are. And I think that may be a path forward for the world. But we will make sure that every step of the way we're doing what is protected for Canadians, what is going to keep us safe, not just from cases of the virus, but from future waves and other variants.
Thank you. And we have time for one more question. Operator?
Yes, and our last question is now from David Aiken of Global News. Please go ahead.
Well, thanks very much, Prime Minister. I guess one of the things I'm sure a lot of reporters have heard from are families in the United States and Hong Kong and the UK, where mom and dad are fully vaccinated with a Health Canada approved vaccine, but the kids are 7, 8, and they have not qualified for a vaccine program. Can you give us your thinking about, I know we want to let fully vaccinated Canadians come into the country without having to quarantine, but what about the families with kids who haven't qualified for a quarantine program? Can you talk about that?
Yeah, no, that's a really, really good question, David, and it's something that is posing a bit of a challenge because at this point there aren't vaccines that we're delivering that are approved for kids under 12. We're hoping that's going to change by the end of the summer, but we need to allow the researchers and doctors, the experts, to do their work to make sure we're keeping our kids safe. We know a couple of things about kids, and of course, the doctors who are speaking a little later can fill in more information on this. But my understanding and what we've seen is kids are at much lower risk of complications from COVID-19 and hospitalization, but they can still transmit and carry COVID-19, and therefore are a matter of concern when it comes to traveling and having kids come into Canada. We're looking at things, understanding that for parents to not have to do quarantine, but kids to have to quarantine for 2 weeks for 2 weeks might be difficult for the families. But every step of the way, we have and we need to continue to put the safety of Canadians first and prevent transmission or spread of COVID-19 and new variants. There may be something we're able to do around repeated testing and guidelines. There may be something we're able to do around other things. We're looking at all that because we recognize that is a gap that is concerning for many families. We will do the best we can based on the best advice, but our priority always needs to remain keeping Canadians and travelers safe.
En français, s'il vous plaît.
Okay, thanks. And just sort of a follow-up on a subject.
Sorry, David.
Oh, sorry, go ahead.
Just let me answer in French. I hadn't heard Alex. C'est une très bonne question. Et effectivement, parce que il n'y a pas de vaccination pour l'instant au Canada d'enfants en dessous de 12 ans et les compagnies de vaccins sont encore en train de faire des essais, des vérifications pour voir comment on peut mieux protéger les enfants. Et si les vaccins, c'est une bonne approche pour les enfants, on reconnaît que des familles qui auraient des parents pleinement vaccinés qui voudraient venir au Canada et qui n'auraient pas éventuellement à faire de quarantaine seraient peut-être dans une situation difficile si les enfants doivent faire une quarantaine. Donc, on est en train de regarder cette réalité, mais à chaque élément, à chaque étape, nous devons de faire tout ce qui est nécessaire pour assurer la sécurité des Canadiens. Et d'empêcher l'importation et l'expansion ou la répansion de la COVID-19. Donc, nous allons continuer de travailler avec la communauté internationale, avec nos alliés, avec les experts, avec les médecins, pour essayer de résoudre ce défi. Mais c'est effectivement un défi auquel on va faire face dans les semaines à venir, parce que justement, même si les enfants sont moins à risque d'avoir des conséquences graves, si eux, ils attrapent la COVID-19, ils peuvent encore transmettre la COVID-19 à des gens plus vulnérables qui, eux, auraient des impacts néfastes.
Follow-up. Okay, thank you very much. Yes, so a lot of people are frustrated about the pace at which we're easing the restrictions on border travel, and I'm sure you're hearing that from your own caucus colleagues. In fact, yesterday, your caucus colleague Nate Erskine-Smith had this comment. I'm going to read it verbatim to a panel on tourism. And Nate said this. He said, quote, "We have an expectation that our representatives follow the science to impose public health restrictions on our behalf. We also ought to have an expectation that they follow the science in lifting those restrictions." End of quote. Now, as you know, your expert panel, Dr. Naylor, has said it's time to get rid of quarantine hotels. In fact, he said it a few weeks ago, and it is time to start easing some of the border restrictions. Nate is frustrated about this, and so I guess the question is, why now are you, the head of a government that says it's into evidence-based policy, ignoring the evidence and ignoring the advice of your scientists?
Thank you, David. The reality is we are actually following the advice of the range of experts that we talk to. And of course, as we've seen a number of times through the pandemic, there are different perspectives from different experts. But let me talk about the element that a lot of people overlook when it comes to fully vaccinated travelers. If you are fully vaccinated, we're going to allow for easing of restrictions and allow for more travel, because you yourself, as a fully vaccinated individual, are protected from the worst consequences of COVID-19, hospitalization, critical care, those sorts of things. That's what vaccination does. It doesn't, however, protect the community around you from catching COVID-19 from you. So when we look at permission to travel, yes, we're going to be easing restrictions around fully vaccinated travelers, but it matters also the level of protection and vaccination in the community to which they return. That's why it's not just about saying, okay, if you're fully vaccinated, have fun, go with it, run around. It's about saying that you're still returning to a country where we haven't yet reached high enough thresholds of second dose vaccinations. Now, we are getting there. We're getting there quickly. But that's why we're looking at a phased approach to easing border restrictions. Not because someone who's fully vaccinated today will be safer 3 months from now, but because the community they're in, the community they're returning to, will be better protected 3 months from now than they are today. That's why there is a progressive approach to a gradual approach to those restrictions, which I get it is frustrating for a whole bunch of people who just want to get back to normal. But it's really important that we continue, as we have from the very beginning, to keep Canadians safe. And if we are able to avoid more outbreaks like we've seen in some places across the country, even recently, by delaying a little bit more, by keeping people safe, so we're not seeing more people in hospitals and more people and more families losing loved ones, then that's the right decision. I get people's impatience, both in the tourism industry and individual Canadians who want to travel. But from the very beginning, we as a government have been there for Canadians, and that means doing what's necessary to keep them safe.
Thank you, and that concludes today's press conference.
Merci beaucoup tout le monde.